Hello, this is Rebecca Maynard. I'm the training manager at WorkCare. Thank you all for joining us today for our webinar on navigating mental health cross currents as employees return to work. This session is being recorded and will be available on WorkCare's YouTube channel within 24 hours. You are on mute, so please submit your questions using the Q&A feature on Zoom. We have allowed time for questions at the conclusion of this presentation. Before we get started, I just want to remind you that WorkCare's Chief Innovation Officer, Dr. Anthony Harris, will be presenting his weekly briefing on preventing and managing COVID-19 in the workplace tomorrow at 2 p.m. Eastern Time, 11 a.m. Pacific. This will be week 14 of the series. And if you haven't registered for the series and want to join us, please follow the invitation link we'll be posting in today's webinar or contact us at info@workcare.com. So it's my pleasure to introduce you to today's speaker, Brittany Bussey, MD. Dr. Bussey is WorkCare's Associate Medical Director for Telemedicine. She is actively involved in our virtual injury triage and leave of absence medical management programs. Dr. Bussey is particularly skilled at helping employers understand the psychological and social aspects of employee health. She will be providing insights on employees' physical and psychological responses to the pandemic and how to help them feel safe at work. So now I'll turn it over to Dr. Bussey.
Thank you, Rebecca, and welcome everyone to my second mental health webinar during this COVID pandemic. We feel it's really important to not just address the physical things that are happening with our employees in returning to work and in experiencing during this pandemic, but also what's going on with employees mentally, and to address some of the underlying thought processes that might be causing different reactions as employees return to the workplace. So the point of this webinar is to hopefully give you an overview of what employees might be experiencing mentally and how to better navigate your return to work process implementation in a way that makes employees feel safe and feel like part of the team. So one of the most important things that we're finding during the pandemic is that there are a lot of things we just don't know. And we actually don't know that we didn't know these things until they were presented to us. And now everyone's kind of scrambling to find an answer. And during the scramble, there are some good answers that come up, and there are also maybe some less good answers. And so we know that everybody is being bombarded constantly with new information, and certain people have an affinity towards some information while others may have an affinity towards a differing opinion. So we talk about these as the unknown unknowns. So it's a famous quote by Donald Rumsfeld that there are these known knowns and the things we know, and the known unknowns, the things that we know we don't know. But there's also this larger realm of unknown unknowns, the things that we don't know, we don't know. And these are these future events, circumstances, and outcomes that we cannot predict and didn't plan for because we didn't know that they exist. So my goal with this webinar is to hopefully shed a little bit more light on our mental processes and how our minds work to try and illuminate some more areas where we can kind of turn some of these unknown unknowns into more of the known knowns. So we know there's a lot of effects that are happening due to coronavirus unknowns. And unknowns are one of the hardest things for humans to deal with. And we talked about that a bit in the last webinar, is that when there's unknowns, we get a heightened state of arousal. And this is an adaptive mechanism that our bodies have developed to keep us alert to new information that's coming our way, especially when regards to threats. So we're staying in this heightened state of arousal and fear because there's so many things out there that are unknown and we don't know. Is it a threat? Is it not a threat? And so our body's defense mechanisms have been elevated. And that resulted in a lot of release of cortisol and adrenaline. And this has actually been going on for a prolonged amount of time. In some people's cases, this may be just adding to a baseline state of hyperarousal that they already have. So let's say we were coming from a state of no hyperarousal into this state of high arousal. We've been here for about 2 to 3 months at this point. And this prolonged state of arousal and fear has increased a lot of psychological as well as physical illness or morbidity. So we're seeing notable increases in depression, anxiety symptoms, as well as PTSD. And so it was kind of early in the window to call it post-traumatic stress disorder. We talked in the last webinar about the acute stress response. But what we are seeing more is that it is heightening the symptoms that many populations already have that have been diagnosed with anxiety and PTSD, especially our minority populations. So we know there's disparities that exist in our minority populations, especially our African American and Latinx communities. They do have a difficult time accessing healthcare, and they also may be more wary of accessing healthcare due to fear of being discovered as being undocumented or for many other cultural reasons. We're also seeing a spike in xenophobia, especially related to our Asian American populations, with this having been labeled the, quote, Chinese virus. Many people may feel that they are under attack if they're part of an Asian American population. So we are seeing increased prescriptions for medicines that are used to treat depression and anxiety, an increased call to emergency hotlines. I saw documented over 1,000% increase in calls to emergency hotlines. They are also more readily available and publicized widely to people, so that could have something to do with it as well. I've certainly seen more advertisements for emergency hotlines than in the past. And also mental health online therapy services. So this is a new field. They were just starting out, and already they are going up about 65% since this started. Anecdotally, we see potentially increase in suicide. There's definitely been a lot of suicides related to healthcare providers during this pandemic, whether they are struggling with their inability to care for people or struggling being out of work and having really high bills to pay. Definitely seeing an increased rate of suicide, which usually corresponds with any large scale economic and health event. Substance abuse potentially is way up, people using substances to cope during these situations, and of course domestic violence, with people being forced into situations where they are now sheltering in place with someone who may be aggressive, and aggression is actually increased during these times, which we will talk about even more later. So as we talked about at the previous webinar, during these times we have that increase in an arousal state. It leads to a decrease in our rational portion of our brain and shunts the blood into those emotional and aggressive centers of the brain, which is why we're starting to see some of these comorbid mental health events on the rise. When we talk about novel viruses, there's two different strategies for keeping people from getting sick and for keeping the virus from spreading. One of those is containment, and the other is mitigation. So we want to talk about ways to keep the virus from spreading as people return to work. You're going to look at a combination of these two strategies. You're going to definitely want to prioritize containment, which Dr. Harris has been talking about in his weekly webinars, and also have other steps in place for mitigation when we have difficulty with containment. So I'm going to talk some more about people's values and beliefs and how they will affect your containment and mitigation strategies during this webinar. But just briefly, containment involves a coordinated response and it has to reach very high levels of acceptance. and it has to be instituted very quickly on a massive scale. So if you're testing, you have to be testing a very large proportion of people. You have to be identifying people early and quarantining them often. We also focus on prompt contact tracing and getting people who have been in contact with someone who tested positive for coronavirus into quarantine and keeping them in quarantine for the 14 days. And this does require massive effort, and it also requires that people are compliant with those recommendations that you're giving them. Mitigation strategies is something that we've done more in the United States, whereas containment is something they did more in Eastern Asian countries. Like South Korea had a really great containment strategy where they were able to get people tested, get people contact traced, and get people quarantined very quickly, and they kept the virus from spreading in their population. In the United States, we sought to mitigate the spread of the disease mainly by keeping people away from each other, so social distancing. We put on travel restrictions, you're using more sterilization procedures in your workplace, and in our communities, focusing on promoting hand hygiene and focusing on promoting masking when we're able to. We found that these return to work best practices, have included, like I said, the containment strategies of testing, contact tracing, and quarantine. And then when we can't contain the virus, trying to keep people, distanced from each other and having them wear masks. And how people respond to you implementing these best practices is going to be based on their mental health, their experience, their cultural background, and also how well you've integrated them into the process of implementing these best practices. We're going to focus here on what is a collective mentality. So these actions that we want people to take, testing, contact tracing, quarantine, masking, and social distancing, is a collective action. It only works if like 90 to 100% of people are doing it. And we need to focus on how do we get people to work together. These collective actions are going to be aided or potentially inhibited by the collective experience. So if you have an overall negative collective experience, you're going to get a lot more resistance to the implementation of virus containment best practices. There are 3 mental models for understanding human behavior that can help us understand the reactions that people are having to these best practices. So, it's very obvious right now that the different people are having very different reactions to the suggestion, even of something as simple as masking. That's something that we're seeing pop up a lot in the news, very excessive reactions to being asked to wear a mask in public. And so I started putting my psychology thinking cap on, and when we see behaviors and reactions that are significantly out of proportion to what is being asked or what is being requested, the stimulus, so the response way overshoots the stimulus, then we'll start to look at what are the underlying human mental models that might help us understand these reactions. And there are 3 parts of how we create action from beliefs and values. And one is emotional memory, one is cognitive dissonance, and the other is something called mortality salience. And these 3, I feel, best represent what we might be seeing in our communities. So emotional memory is the first thing we're going to look at. It's different from your declarative memory. So declarative memory stores the who, what, why, when, and how. It's something that you consciously recall. It's stored in the hippocampus, and this is regulated by your temporal cortex. So these are higher level memory functions. So this is storage and recall, for instance, for taking a test, for remembering people's names, for remembering lists and doing actions, all of those higher level functions that a lot of us do day in and day out at work, we're using our declarative memory for that. That is contrasted to different parts of our non-declarative memory. So there's operational non-declarative memories, like riding a bike. You just get on it and suddenly you remember how to do it. And there's also these emotional non-declarative memories. And emotional non-declarative memories are regulated by the amygdala. And they are not associated to who, what, when, where, why, how, and how. They were stored during a period of moderate to severe stress. So, in this case, I was looking at potentially with masking, like what kind of emotional memories maybe did people store around surgical masks? So if we think about things that are moderate to severe stress that could be associated with surgical masks, of course, we're going to think of anyone who has experience in a hospital. Usually you only see people wearing masks during trauma or times when there's a likelihood of contamination, of something being toxic. Actually, a big one that I thought about is the trauma of birth. We don't necessarily think of birth as being traumatic. We think of it as being beautiful. But if you think about yourself as the baby, you're going from this nice, warm, safe place, and you're suddenly forcibly shot out into a dark, cold area where a bunch of people are wearing gowns and masks, and you're kind of in this bright, scary, new environment you've never been in before. So maybe culturally we have some emotional memory stored that could be relating to our fear of masks. So these periods of moderate to severe stress will store the memories, and then when they're recalled again during a period of stress, it can lead to an excessive reaction, which is out of proportion to the stimulus that has caused the reaction. So as we talked about in our last webinar, when we think about how the brain operates under times of stress, the areas of rational thinking, of declarative memory, the areas of the cortex are not receiving as much blood flow. The adrenaline and cortisol is shutting down those higher levels of mental processing and really moving blood down into the midbrain, which is where we're likely to have these emotional memories both stored and retrieved. So we're going to be having a lot more reactions from those emotional responses of fear, of anger, even sadness, grief. All of that is being brought up from our current experiences because so much of our blood flow for our brain is really being shunted to those survival areas. And those survival areas are contained within the midbrain and the brainstem. And we think it's just much less important to use those more evolved areas of our cortex during times of threat. Another piece of this puzzle is something, again, it's an emotional response. It's called cognitive dissonance. And our brains are programmed to align our beliefs and our values and our attitudes with our behaviors. And we are programmed to keep that inner peace at all costs. So when something comes along and it is inconsistent with a belief or value, then something needs to change. It causes an extreme amount of tension within the mind. So you're going to have this push and pull happening between what we strongly feel as a value and the behavior that's being asked. And so a lot of times where you see cognitive dissonance become activated is during forced compliance behavior, which is something that we're seeing a lot of now. We're being told to do something or else. Like, you can't go to the grocery store unless you put this mask on, we're not going to let you in. So that's forced compliance. We're not being asked if we want to do it, we're just being told you must do it. And that behavior that's being forced, if it's inconsistent with our beliefs and values, is going to result in an excessive overreaction in the opposite, to bring that back into alignment. I'm going to do an action that is in direct conflict potentially with what I'm being asked to do, and I'm going to exaggerate that behavior to make it very clear that this is out of alignment with my values. The other thing that pushes us to it, if we're forced into a point where we need to really make a decision about something, we might fall back on behaviors that are more in alignment with our values, or if we're asked to make a significant effort. So anytime there's mental effort involved, our brain's going to want to fall back into what are my values and how can I keep my actions in alignment with what I feel my values are. And the third piece that we're seeing right now is something called mortality salience. And mortality salience is a psychological state that occurs when people are faced with the potential of death. Usually their own death, but it also could be the death of somebody close to them. And there's nothing more poignant to this than a pandemic. We're being told there's a virus out there. It could kill you. It could kill those you love. So suddenly we're being forced to really think about our own death. And in our culture, we don't do that very well. We try to avoid death and aging and anything associated with it at all costs. Again, we're going back to cognitive dissonance. We don't value or have beliefs that are in alignment with death being the ultimate result of life. Our values are more into prolonging life and avoiding death at all costs. So when you're faced with the possibility of death, scientists have noted many significant effects when they put people into groups. They give them a situation in which they're faced with their own death, and they try to measure people's reactions to this. So these different studies have shown that they tend to polarize people. So people will tend to move toward their group, their in-group, and start to show a lot more aggression towards an out-group. So we're going to start to have people pulling in more based on, their cultural backgrounds, maybe their political beliefs, whatever they feel their in-group is. Who do they relate to the most? And then, not just pulling inwards, but also pushing aggressively outwards. And less community-minded or communal-minded actions are taken during this time. They saw an increase in prejudice, an increased motivation to acquire power. So again, looking at what people do to acquire power, they will try to assert control over situations that they have no control of. And they'll do this a lot more aggressively than they would during times when they're not being faced with the possibility of death. One specific study showed that men increased their dominant and aggressive behavior as compared to women. And they showed a lot of more negative behavior and aggression to those people who violate cultural norms and values. So, very simply, people are being very aggressive, if you haven't noticed already, in the grocery store with the people they feel aren't following the rules. So people won't just, kind of quietly accept that somebody's doing something they don't agree with anymore. They will voice their concern, potentially get aggressive towards that person, and it's causing a lot more violence and aggression to be shown in our communities in general. And so the last thing we want is to have this brought into the workplace, where people are going to start forming these in-groups and out-groups and start trying to acquire dominance and power over each other. So it would create a very hostile working environment as people are trying to navigate their return to work. So I had this great quote from our executive chairman, Dr. Greeny. He sent us some write-up that he had done about the coronavirus. And one of his statements I found to be very poignant in this situation is that we seem to be at a standstill. And are different Americans experiencing coronavirus very differently. And I read another article that said that we have an experience of different Americas right now. And so what Dr. Greeny felt is that a third of Americans seem to be holding steady with vigilance and self-preservation. After these many months, they're still going to be following the rules. They're still going to do what they think is necessary to keep themselves and others safe. Another third are kind of just waiting for someone to tell them what to do. They're in limbo and they're really not sure what direction to take. And there's another third who are in denial and who simply don't care or don't believe that the pandemic exists and would like to resume the life they used to have. And we're certainly seeing that portrayed very heavily in media. And that's creating a situation, a type of bias, where we're seeing that 1/3 of people amplified. And we're starting to think that this is a much bigger situation than it actually is. So there's a smaller proportion of people who are acting out, at least prior to the current situation that we find ourselves in, with the Black communities, when we had just the people pushing outward, wanting to protest, we want to go back to life as it was before. I want a haircut. I don't want to wear a mask in public. I don't want to talk about vaccines. I just don't want this to exist anymore. We want to cancel the virus. We want to say the virus is completely eliminated. And that's simply not the case. Viruses don't just go away. We find ways to, like I said, contain and mitigate the spread of the virus. So as the people start to return to work, we want to think about how are different people going to experience our best practices. So I picked 3 of the practices and was really motivated to come up with some of the pros and cons that I'm seeing out in the community. And then we can talk about how to create situations where everybody maybe feels like they're more on the same page with each other. And there are 3 things that I found to be maybe the most decisive and the most isolating and polarizing in the effect of differing opinions. And the first one we've been seeing a lot is simply wearing a mask. So am I going to wear a mask or am I not going to wear a mask? And my goal with this was really to understand why people might have different opinions on wearing a mask, because it's not as simple as, Democrats think we should wear a mask and Republicans think we shouldn't. There are a lot of nuances when it comes to people wanting to wear a mask versus not wanting to wear a mask on both sides of the potentially political spectrum. So the pros of wearing a mask, and the reason why we've said this is helpful, is because it's going to reduce the spread of droplets which contain the virus. So we found that this virus spreads fairly easily from person to person. Each person who's infected has the ability to potentially infect up to 3 other people. And this is not including the super spreader events or other events where people are projecting loudly, spreading potentially more virus during that time. But just the regular person speaking at a normal volume, breathing, coughing, or sneezing every once in a while may potentially infect 3 other people because of the spread of the droplets. And the droplets are what we believe contain most of the virus. So when they tested different kinds of masks, they found that surgical masks blocked better than cloth masks, but the cloth masks were still potentially somewhat effective at reducing the droplet spread. And the goal of this is that we're trying to stop spread from asymptomatic individuals as well as pre-symptomatic individuals. So we find that temperature screening is great if people are going to develop a fever. And actually a day or 2 before they get a fever, they're already capable of spreading viral droplets. So if we want to prevent people who have just been exposed to the virus from spreading droplets, or people who may never develop any symptoms, the best way to do this or to mitigate the spread would be to have everyone across the board cover their face. It's simple, and for the most part, it's cost effective. What we found to be the cons, and there was a great study in Colorado, the Colorado Department of Public Health simply just asked people, I believe it was through Twitter, to respond to their survey of, will you wear a mask or will you not wear a mask? And if you won't, why won't you do it? And they got a whole bunch of answers back from different people, but they kind of fell into these different camps. One was potentially political reasons. Donald Trump is not wearing a mask, therefore I'm not going to wear a mask either. If he doesn't want to do it, then I don't want to do it. And that, again, we saw that in group versus the out group really kind of pulling in together and joining each other. Some people are saying there's no proof it works. And, really looking at the data, there is certain data and certain epidemiologists and certain infectious disease people who don't believe that masking is really that effective. They think that, if it's reducing the droplets, it's not reducing them enough. The other argument was it could make me sick. And again, they saw that in some of the studies that people wearing masks were more likely to touch their face, were less likely to respect social distancing guidelines, and the social distancing was actually more effective than the mask wearing. So they found that people wearing cloth masks actually could get more sick because they weren't following some of the other rules for hand hygiene and social distancing that also help people get sick. We also hear, I can't breathe comfortably with it on. And that can be an impediment to wearing the mask. You'll see people pull it down frequently and trying to breathe over it, not covering their nose. So if they sneeze or they're kind of playing with it near their nose or their mouth, again, potential for more spread of viral droplets if it's uncomfortable. And then, of course, simply don't tell me what to do. And again, we saw that with mortality salience. People want a sense of power. They want a sense of control during this time. They do not want to be forced into compliance because of cognitive dissonance. They simply want to say, do not tell me how to live my life. If I'm going to get sick, then I want to be sick. And that's certainly a position people could take. But during a public health crisis, it's not necessarily the concern that people will be sick. It's that there will be so many people who are sick that they will overwhelm our healthcare industry's ability to deal with it. And when the healthcare community gets overwhelmed, the resources are used up more quickly and more people die. That's exactly what they saw in Italy, that they simply didn't have the resources to accommodate the number of people who were infected at once, which is why mitigation strategies are so important. We really want to slow the spread of disease to keep our healthcare industry from being overwhelmed with infected individuals. The next best practice that I looked into was testing. So again, you think testing, that sounds good. You know, we want to get people tested. We want to identify the infected individuals and we want to quarantine them. We want to keep people who have the infection from spreading the infection to other people, and large-scale testing will hopefully eventually slow the spread of disease. The problems that we're encountering right now with testing is that the results seem to be a bit unclear. So depending on the type of test that you're receiving, the manufacturer of the test, the lab that it's being run at, we're getting different sensitivities and specificities. And the worst part of that is the low sensitivity that many of these tests seem to have. So if you have only a 70% sensitivity, that means for every 10 tests, you're missing 3 people who have the illness and you're not diagnosing them properly, and they're going back out into the community and continuing to spread disease. So if you don't have accurate testing, you're going to have a lot of issues. So we didn't know that that would be a problem. We had to develop these tests quickly, but unfortunately they're not as accurate as they could be. Definitely getting better, and we're, here at WorkCare can definitely help you to identify which tests are better than others. That's something that Dr. Harris has been working on extensively. Another area that people are afraid of is, what is the intention of the testing? Why are we trying to identify people who are sick? Or not just sick, but those with antibodies? What is the ultimate goal of this? Anthony Fauci mentioned immunity passports. Do we give people who test positive the sort of carte blanche to go about their business, where other people who have tested negative are continuing to be restricted in their activities? And again, you're going to get that cognitive dissonance there. Belief and value many people share is fairness. Like, is that fair? Did I follow the guidelines? Did I keep from getting sick, only to be later punished for that? So I don't want to be tested because I don't want to be discriminated against potentially. We see people who are afraid of being tested because they're afraid they could lose their job. Whether they, again, is it because of a positive antibody test or negative antibody test, or just a test in general? So are they going to lose their job temporarily or permanently? That can be very fearful for many people, especially those people in positions where they live paycheck to paycheck. They have a lot of expenses, a lot of liabilities, a lot of people counting on them, potentially the sole breadwinner for a large family. You're going to be afraid that a positive test means that they're not going to be able to provide for themselves and their families. So they may be very resistant to being tested. undocumented citizens are really afraid of testing and any healthcare services right now. They see healthcare services potentially as a representation of government. There was an act that was enacted actually just before the coronavirus epidemic hit, called the Public Charge Act, that said that undocumented citizens who accessed any type of government services could potentially be flagged for deportation. There was an announcement made that that would not apply to coronavirus or coronavirus testing, but people who are afraid of deportation are not necessarily going to get that information, and they're going to be really afraid. And unfortunately for us, these are people who may have higher risk of getting exposed to disease because they live in very dense communities. They may have a lot of people in one household, a lot of young people in their household who are more likely to pick up the disease and spread it to others. And finally, stigmatization is a really real thing. Like, people are afraid of being stigmatized for the results of their testing. They think people might avoid them, or they might have a fear of physical violence being enacted towards them if they're found to be positive for coronavirus. They say, I came to work a couple days, wasn't feeling great, like I might have had a stuffy nose. 3 days later, I get tested for coronavirus and find out I'm positive. Now, maybe my coworkers are really mad at me for coming to work because now they're getting calls saying, oh, well, Dr. Bussey was positive and she was around all of you. So now none of you can come to work either. Those people potentially are going to be really mad. And I'm going to be potentially afraid of violence or other kinds of social stigmatization. And the last method that I wanted to look at was contact tracing. Again, really great. It's a good containment strategy. It's been proven to be helpful, especially in Asian countries like China and South Korea. It's been, we've developed some simple and effective technologies in those countries that assist them with contact tracing. I had a really good TED Talk with a woman who's felt to be the Oprah of China, and she talked a lot about contact tracing and the way China uses facial recognition as well as, GPS on their phones to signal people when they've been in contact with somebody with coronavirus, and then flag those people, keep them from moving around. So she said she wanted to go to the mall, and she actually had to have her face scanned and be cleared via contact tracing in order to go in. To her, that made her feel more safe. In many countries, authoritarian countries, people accept that, like that there is an amount of safety that is gained in exchange for personal privacy. In America, we don't necessarily feel that way. We like our privacy. We don't want to be told what to do. So contact tracing in America relies on the Americans, first of all, accepting a call from a stranger. So I don't know about you, but if I see an unknown number pop up on my phone, I'm not answering it. I'm going to let it go to voicemail. They don't leave a voicemail. Even if they do, I may not respond. So first of all, your Americans have to accept these calls from the stranger. Once they've accepted the call, it relies on them giving out personal information. Again, how many times are we told, don't give your personal information out to a stranger? And finally, they have to take the advice of this stranger who's telling them, you need to self-isolate for 14 days for the good of others, and may or may not feel that is appropriate. So if I have more of an individualistic approach, I might say, nope, I'm not sick. Thanks for the call, but I'm not going to do it. Versus, if I'm like, okay, I don't want to get other people sick around me, I'm going to go ahead and self-isolate for that reason, even though I don't feel sick right now. It's a lot easier to do in our workplaces, hopefully, because people have some incentive to follow the rules of the contact tracing, to isolate. They can be supported during this time, but out in the general public, we may have a harder time with contact tracing. It also requires a really large number of individuals. They estimated anywhere between 100 and 180,000 individuals would have to be trained in contact tracing in order to contain the spread of disease. Another fear with contact tracing is in the technology that's being used. There was a website they went to where they were actually listing every single app that was coming out as a contact tracing app, and listing the pros and cons, because there's no transparency. Just like we know of in the App Store right now, you could buy an app, it could absolutely not do what it said. It could be farming for information, they could be data mining, all sorts of things. A lot of these technologies that are being developed, there is absolutely no regulation on them, and it's not being monitored appropriately. We have the fear of loss of privacy. And again, a lot of fear coming from minorities and immigrants. One in particular I saw that was very surprising to me, not coming from that community, was that somebody felt that contact tracing could be used to, quote, steal children. And coming from an immigrant community, that can be very poignant to them, because maybe they lived in a different, communist regime in Eastern European countries, where that was a very real thing. People were traced and quarantined and grouped in such a way that they were marginalized and treated differently, and their children could have been taken away because of that. So they're very fearful of the government trying to keep tabs on them in any way. So now I want to switch gears a little bit for the last part of the talk, and talk about how to make these programs more effective in the workplace. This really focused on, what are those attitudes in the community, but we know that, in our workplaces, we are a cross-section of the communities that we live in. So what I love about occupational health, I always thought occupational health is beautiful because you're looking at the social, psychological, and biological effects of workplaces as small environments. So these workplace environments and communities, how do we bring people together in our workplaces to create a more cohesive in-group? So John Lessler, the epidemiologist at Johns Hopkins, says if you have all the resources in the world, you can buy all the tests and do all the contact tracing and supply everyone with a mask, but you have an antagonistic relationship with your people, you're going to fail every time. So when we talk about navigating return to work amid all of these employee concerns, what are some things that we as employers and health professionals and health and safety professionals can do to bring people together? We want to maintain the privacy of individuals involved in contact investigation. So that really addresses what we talked about: lack of privacy, fear of stigmatization, fear of aggression. We don't want to go out there and start broadcasting, is responsible for these things, who's under investigation, who's not, because you're going to start splitting people into camps and groups in that way. You want to effectively communicate the presence and also the absence of risk. So what things are going to be a risk, such as, being too close to somebody for 20 minutes, being in an area where people are potentially projecting their voices very loudly, and what kind of things are less risky. Simply being in a grocery store, they found to be very low risk, being around other individuals for shorter periods of time can be very low risk. And also sharing very accurate information about how the virus spreads and how we're seeking to mitigate the spread. It's really important to speak out immediately against any negative behaviors you might be witnessing. So any forms of aggression, really taking those things and denormalizing them, making them seem like an outlier. Like, this is a negative behavior, this is not acceptable, this person was an outlier. We do not want this to become the norm. We cannot normalize negative behavior towards individuals or towards groups. So whether you're seeing it at work, in the news, or on social media, it's really important for us as leaders to speak up and to speak out against any kind of negative behavior that we see, and to talk to people about why it's against our values or our company's values. We want to engage employees individually so that we don't reinforce any kind of marginalizing behavior or stereotyping. And also to ensure people that we are providing support to affected families and individuals, whether that's, health support for everybody, making sure again that those marginalized groups do have access to healthcare providers, whether that's mental health or physical health providers, that we're making sure people do have access to financial resources, and that we're identifying resources, social resources in the community that can help people dealing with impacts from coronavirus. You want to really fully engage your employees in this process. Again, like I said, if you have an antagonistic relationship, your implementation processes are going to fail. So when you're coming up with these best practice processes, you're already going to potentially have your roadmap and your game plan for getting everyone back to work safely. People may or may not believe that this is a thing that you're doing. We hear many employees say, I don't want to come back to work because I don't think I'm adequately being protected. So we really want to engage the employees. Again, like I said, our workplaces, our cross-section, our community. So how can we create a group of employees who start to care about each other's welfare so that they can take that care and spread it out into their community? So we want to gather people together in a representative group, everyone from management to maintenance, and taking a sample from each of those areas and bringing those people together and finding ways to foster connections, ways to create one cohesive in-group so that we see each other as one in the human community. We want to find ways to nurture healthy thinking and communication among employees. So promoting stress management, promoting any counseling resources that you have, and actually encouraging water cooler discussions on people's principles, beliefs, and practices so that people can understand where each other are coming from, and so you can be a part of that discussion as well. You don't want these discussions happening outside of your knowledge. And then again, finding ways to engage employees more meaningfully in their work. So as employees return to work, finding meaningful projects for people to work on, finding ways to bring people together outside of the realm of just getting things done. And lastly, we want to really focus on how do we get employee buy-in. So we've created these groups. We've discussed in depth what our best practices are going to be and why they're good for everyone. And now we want to communicate that to our larger work community. It's important to be very clear about the purpose of the project. Again, we talked about people are very afraid of testing potentially because there's inaccurate information and we're not clear about what's going to be done with the information. So be really clear about your vision and purpose for these mitigation and containment strategies. Explain how test results will be used and provide related resources for people. And talk with any employees who raise concerns to try and find common ground solutions. Like I said, whether you do that one-on-one or create cross-sectional groups of concerned employees with potentially polarized concerns, you could bring people together and maybe have them focus on how do we find a solution. You can show employees how everyone actually benefits from the programs that you're trying to implement. So you don't want people to feel like this is antagonistic, that this is a forced compliance program, that it's a program that's meant to benefit everyone and having very clear benefits for every individual. Have accurate information to distribute, and most of all, we want to treat people with dignity. We do not want to judge people. Don't yell at them. Don't insult them. Don't call them stupid for having certain views. We've looked at throughout this program that I tried to develop today, it was because I myself was having some biases come up about why people might not want to wear a mask in the grocery store, or why are they being so difficult? And it was very exasperating for me. And I wanted to find a way to understand. So the whole goal here is to understand differing points of view and to treat people with dignity and to validate their concerns, just like we talked about in our last meeting, was that when you validate someone's experience, you really start to bring them into a place where they can be empathetic with you and you can be empathetic with them. But we can't have empathy for each other until we validate and actually see each other as human beings having a human experience. And so we find that crises are only political until they are personal. And so we really want to bring this to home, that this is a personal experience, that our workplaces, our communities, they're filled with people who are like us in many ways. And I think that the most important thing we can do during this time is find more ways to come together, even when we're apart. So that's all I have for you today, and we can move into any questions for the last 9 minutes.
Thank you, Dr. Bussey. I do have a question from our Q&A. How does stress from the pandemic affect individuals who struggle with addictions such as alcohol or drug abuse?
So I think what we were seeing, and I talked about this a little bit in the last webinar that I did, so you can go back for more information, but very, briefly, during times of stress, we're going to find ways to cope. And if our coping mechanisms have in the past included drugs and alcohol, we find that could be a way to potentially tone down the emergency response that our brain is having, just shut it off, even just for a minute. So when people find that drugs and alcohol have in the past toned down their alert response or their arousal response, they're going to turn to that again, and they may turn to it more frequently depending on how hyper aroused they are. So we might see this as more of a continuing spiral of arousal, use of a drug or alcohol to calm down arousal, then arousal actually comes back higher than it was before the substance was ingested, then more substance is needed to tone down the response. And it becomes a really self-defeating cycle. So that's where we start to see people slipping into these addictive responses.
And a follow-up question to that, if we do see someone slipping into those behaviors again, what can we do?
I think it's important to just ask people. We talked about that also in the last webinar, is ask, don't assume. If you see somebody who you think is struggling, and coming to them and just saying, I care about you. I see you might be struggling in this situation. Is there anything I can do to help? And giving them space to open up to you, even if you don't know what the right answer is at the time, coming to them and giving them a space to open up and talk, and then maybe trying to find a solution together rather than judging that person and saying like, oh, I see you're drinking a lot. That's really causing a problem for me and those around you. Like just saying like, hey, I see maybe you've started drinking a bit. Is there anything I can do to help in this situation? I just feel like if it were me and I had started drinking a lot, it might be because I'm really feeling a lot of anxiety and fear about this situation. Is there really anything I can do to help you? And just being aware and being present to that person's experience.
Okay, and then when we think about the work situation too, I have another question. What should a supervisor do or say in a moment when they see an employee having what appears to be an overreaction to a situation? So without saying to the person, you're overreacting, how can we de-escalate and or de-normalize a challenging situation like that?
I guess in that situation, what I would want to do first is try and remove the person from the stimulus. So if they're really having an exaggerated response to a stimulus, if it's another employee, we're going to want to remove them from that situation as quickly as possible. Try to let them come to a space where they are de-escalating naturally, because nobody is going to come from a rational place when they're in that emotional mind. So like we showed in the beginning, when you're having an emotional reaction, you're shutting down your frontal lobe. So it does not help to try and tell that person, you're overreacting, calm down, because they're so in their emotional response that that's going to be met with another emotional reaction. So like giving them some space, letting them come to a place of more calm, and then just asking, what happened, and have them kind of walk back through it with you in a de-escalated environment, and then try to have them identify where that reaction came from and find solutions to keep that from happening again in the future.
Mhm. Okay, thank you. Those are all the questions we had. So this concludes our session. Thank you, Dr. Bussey, for guiding us through this very important topic. And thank you, everyone, for joining us today.
Thank
Thanks,
you.
everyone.
Have a great day.
Thanks, you too. Bye.